So transition is for anybody who's got a long-term condition. They're already currently cared for in the children's service and they're moving into the adult service. So it's the process of preparing and supporting them and empowering them to move from one service into another. So the age range for transition at Leeds Teaching Hospitals is between 11 years to 25 years. So it's that move from primary school into high school. So for some it might be nearer 12 years. The transfer point within the transition process is different for each service. It's usually around 16 to 18 and we have support for transition up to the age of 25. When you're in transition, your nurse or your doctor may talk to you about transition. They may mention this around about 11 to 12 years and they'll talk to you about the Ready Steady Go programme. So the Ready Steady Go programme is a set of questionnaires that help us understand what your needs are when you're going through transition. So it'll ask questions about what are your aims, so what are your aspirations, what do you want to do in the future, what are the things that you struggle with and what do you need to know about your condition. It might be about the type of condition you've got, it may be your history of operations or your admissions to hospital, or you may want to know a little bit more about your medicines. So what medicines do you take, the names of your medicines, the doses and any side effects, so that when you move to the adult service you've got a bit more of an understanding of your own condition and you can then start to make some decisions for yourself. When you're in the children's service, your parents quite often make decisions for you or help you to make decisions. When you move into the adult service, you start then thinking about how you might want to make decisions about your own healthcare, and maybe you want to talk to the doctor on your own. There'll be an opportunity to do that when you're in the transition process. So your nurse or doctor might ask you if you want to come into the consultation first on your own for a short time before they invite your parents in. And that's just so that you can ask any questions that you may want to ask, not ask in front of your parents, but also so you can get used to asking the doctor questions on your own. When you're in the adult service, you will be asked to come along. You may have your parents for the first couple of consultations, but then you might want to go on your own.
I use Ready Steady Go quite frequently with our patients and clients that use our service. I find it's a good tool to get people to engage with their own care and learn a little bit more about their needs and how they can best represent themselves as they get older and then they move into adult services. It's a good tool to get talking and thinking about such important things as the medication, the future therapies, and about general life and how they might engage and deal with issues such as work, as future employment, sexuality, dealing with benefits and other aspects of general life. I've found that I've engaged very well with it and that people ask me questions I'm surprised about and reflect back on what we've talked about. I use a staged process, but I've got very positive responses so far, and to a degree seeing positive effect in the care as well.
So your parents or carers may be worried about transition. They may be worried about you going to the adult service and whether you have enough knowledge and information to move through. Do you know enough about your medications to make decisions? Well, the Ready Steady Go programme does have a questionnaire for parents as well, so we can help and support your parents through the process because we do understand that it is difficult for them. They've been helping and supporting you make decisions for a very long time in the children's service, and it can be quite tricky for them to let you go and make decisions for yourself. So we can help with that, and if you've got any worries about it or if your parents have got any worries, then please do speak to your doctor and nurse and we can help them with the questions that we can ask, and we can put some extra support in place for them. So you may have been in the children's service for a long time and you may have built some really strong relationships with your medical staff, your nursing staff. You may know them really, really well and they know you really well. So you may be worried about moving to the adult service and them not really knowing you. You may be worried about the differences in the adult service and what's going to change. There are differences. It will be different to the children's service, but part of the Ready Steady Go programme will identify what changes there will be for your service. Every service is different, so if you've got diabetes, if you've got a liver condition, if you've got a renal condition, all the services are different, but they all have the programme in place so that you know what the differences are like when you're going through to the adult service. There are opportunities for you to go and see the new clinic and to see the ward. If you're concerned about anything, please speak to your nurse or your doctor about it, and they can arrange visits to the wards and departments. Alternatively, you could look on Leeds Children's Hospital TV and have a look at the Welcome to the Wards. There will be transition films on there, and you can have a look and see what other people have experienced going through transition, what their fears were and how they feel now about transition and how that's changed over time. You can also find out about the adult A&E departments, so if you had to come in an emergency, where would you come to and what would it look like?